friends, welcome to another Renee's Corner video. Today's video is going to be a bit different. I have invited my friends Ruth and Noam, they are husband and wife, to come on the channel and talk about the differences between a psychiatrist and a psychologist. This will kind of build some variety in the channel, and also it would be much better to have people who are actually psychiatrists and psychologists, or psychologists in training and a psychiatrist resident talk about psychology versus psychiatry. And so enjoy the video, and I will see you guys on Thursday. Peace.
Hi, I'm Ruth.
And I'm Noam.
And I'm training to be a psychologist.
And I'm training to be a psychiatrist.
And we just wanted to make a video talking a little bit about what that means, because people get them mixed up a lot. And part of this, I feel like, is because of the way that it's portrayed in the media and like movies.
The one thing I have against like Harley Quinn and Birds of Prey.
Yeah.
That was just...
Yeah. Anyhow. And the other thing is, like, it makes sense that it's confusing because it's kind of a Venn diagram of, like, a lot of the things that we do are similar or the same, and then there's also a lot of things that we do that are different. So why don't you take it away? Tell us what's different.
So I guess one of the biggest differences between psychiatry and psychology is how you get to be one. So the education that you the path of education that you take to become a psychiatrist versus psychologist. Mm-hmm. As a psychiatrist, I went to medical school, so I am a medical doctor, and then I specialized in the field of psychiatry. So to get to where, to be a psychiatrist, what happens is I took a bachelor's degree. So I did my bachelor's degree 4 years, at least in Canada and the United States. And then after doing a 4-year bachelor's, I went to medical school. And then after 4 years of medical school, I got into a residency in psychiatry. So the bachelor's degree doesn't have to be any specific degree in any field. It can be a Bachelor of Science, Bachelor of Arts, Bachelor of whatever. The biggest thing is that A, you complete your bachelor's, and B, you have to take a few core science courses and one English course. So you have to take 1 year of general chemistry, 1 year of organic chemistry, 1 year of general biology, depending on your program, either a year of physiology or biochemistry sometimes, a year of physics, a year of calculus, and then a year of English or arts. And then you have to take the MCAT, or Medical College Admissions Test, which, again, not every program, but most programs require you to take to be considered. And then once you take the MCAT, you can get accepted into medical school. Then you do medical school, again, in Canada and the US, most often 4 years. And then afterwards, you get your medical doctorate. And then you can go into residency and specialize in the field of psychiatry, which is another 4 years, and that's where I am now. That last part, that 4-year residency, is salaried versus the other parts, your undergrad and your medical degree, which are tuition. Yeah. You have to pay tuition.
Yeah.
And then what makes you, or what do you have to do to become a psychologist?
So I also did a 4-year bachelor's, and that's where I met my husband. So that was nice. And after that, I had to take the GRE, which is the graduate something examination. And there is a more general one, kind of, that it's very common just to take across disciplines. And then there's a psychology specific one also that is required by a bunch of programs. So if you're applying, then like I was kind of like, might as well take it for anybody that does require it. And then once you do well, hopefully well enough on those, you get accepted to a PhD program. And fun fact, or a PsyD program, but I'm going to be talking about the PhD in clinical psychology. So my program is 5 years, but it can also be 6 years. And that makes about 9 or 10 years of school for me, and about
12 years of school for me.
Yeah, so either way, you're going to be in school for a long time.
Significant amount of time.
Yeah.
It's worth it.
Yeah.
Depending on who you ask.
Yeah, exactly. So that's kind of how we get to where we are.
Yeah. And then, so one of the big differences then as being a medical doctor, or again, you don't have to be an MD, you could also be a DO, which is a doctor of osteopathy. There's a lot of similarities there. You still have to specialize in psychiatry. So one of the major differences that leads is that as a medical doctor, I have prescription rights. So I'm allowed to prescribe medication. And since I can prescribe medication, and in most states, psychologists cannot prescribe medication, what that often leads to is a lot of the people I see, though we believe that therapy really helps, my role is often to be that from the prescriber side, the medication prescriber side, because that's something that I can do that other fields cannot do. So often, that's where we come in, given, there's such a need for everyone in every part of the field. As a result, also, I'll often see a lot more acutely ill people, especially those sort of in the psychotic realm of mental illness or manic realm. So when you have somebody, there's many mental illnesses, therapy is really helpful in treating a lot of them. But when somebody's in an acute psychotic or manic episode, really, it's really, really important that they're taking the right medication.
Yeah, it would be hard to do therapy.
So what I would do at that point is, again, I can see them for the medication side, and then once they're a little bit more stable, we can see them for therapy. And then for depression and anxiety, we can also provide medication, we can also provide therapy. And that's where we can also get help from psychologists, especially when it comes to therapy. Now, because again, I'm a medical doctor, I'll sometimes, I work in many different places, clinics, out private practice, hospitals, and all those places you can also see psychologists.
Yes, that is true.
Just sometimes slightly different roles.
Yeah. So, like you said, places where you might get more acutely ill individuals are places where you're more likely to see a psychiatrist, like people who need more like a medical management type of thing. And psychologists might also be in those places, but they might be taking kind of a more different role. As a psychologist, what I'm more doing is either assessments or therapy. Those are kind of the two things. Do you want to talk a little bit about assessment, or do you want to talk a little bit about kind of where we both are in the biopsychosocial model?
I think I'd prefer that first, if you're okay with that.
Okay, yeah.
So when someone comes to see me, or I think you, but correct me if I'm wrong, what you want to do is, what we want to do is when I look at someone who comes in for help or is coming in with a mental health issue, say for example depression or anxiety, we look at them through what's called the biopsychosocial model. So what that means is you want to take into account the biological aspects, the psychological aspects, and the social aspects of their illness. To explain, mental illness can be contributed by either misfiring of chemicals in the brain, so that's the biological aspect. There's the psychological aspect, where it's maybe bad ways of interpreting a situation, negative coping skills, poor ways to approach a problem, or non-constructive ways to approach a problem that sometimes make an issue worse. So that's the psychological aspects of a mental illness. And then there's the social aspects of an illness. What's going on in your environment or in your surroundings that could be contributing to your mental illness. Could be poverty, it could be trauma, it could be, like abuse, for example, or just a lack of basic needs for living.
COVID.
So the whole idea is that when you want to look at somebody and help them in a mental illness, you want to make sure that you're taking a look at the biological, the psychological, and the social contributors to that illness. Now, as a psychiatrist, one of the things that I guess makes my approach to patients slightly different from that of other mental health professionals, such as psychologists and social workers, is that my training is a lot more focused on the biological aspects, and having prescription capabilities or prescription rights means that I can help with interventions to the biological aspects. Now, that doesn't mean I cannot help in the psychological or the social aspects, but if only a few of us can help with the biological side, what we try and do is we try and involve psychologists and social workers to take care of the other issues that are in no way less important, and it's just that they have more training specifically for that area. So, we want to get them involved and have them to help while we help from the biological side.
Right. Yeah. So then that brings us to the psychologist is more able to help with the psychosocial pieces. So again, that might mean, going to therapy to address any kind of cognitive distortions, any kind of behavioral things that you might be wanting to change that aren't helpful. I did want to mention that one difference between psychologists and social workers, because that's another one that sometimes gets confused, is psychologist is a term that can only be used by PhDs or PsyDs. Otherwise, you can say psychotherapist or therapist. But specifically, psychologists are people that get yeah, you didn't know that?
I thought you could get a master's and still be called a psychologist.
So no, it's specifically for that.
I learned something.
I'm glad I could teach you something. So so we're kind of more able to focus on the psychosocial aspects. And that's also part of the reason why we work together closely, is because when you're trying to treat one person, you're trying to treat psychosocial, so you're kind of doing everything. And that actually, I feel like summed that up nicely. I wanted to also touch on assessment a little bit. So what if somebody comes to you and they say, "Doc, I have the ADHD."
So what happens when someone comes to me into our office? We do what's called it's clinical assessment. And this is for people that, we've got, it's called the DSM-5 or the ICD-10, and it's a book that talks about the various mental illnesses and what the criteria are to meet any various mental illness. Now, there's a lot of people that walk in the door and they fit that rubric really, really well. They come in, it says you need to have these symptoms, they have those symptoms to a T. Great, I know exactly what you have, I know exactly what we can do. However, then there's other people that come in and, they don't really fit this criteria, or they don't really fit into that box exactly, or they don't fit into this box exactly, something doesn't really seem to fit. So that's when we ask for something called neuropsychological assessment.
Yeah, and psychologists, that's something that we do kind of more in-depth assessments, whereas you might base your diagnosis on the clinical interview. We would base a diagnosis on clinical interview plus a whole barrage of tests, and that's a big part of our training as well, is that we learn how to administer and interpret all of those tests. So if you come in, we might have you do puzzles, perform a task over and over, or specifically don't perform a task when we say don't do this. You might answer a bunch of questions about your feelings. So there's all different kinds of tests. And again, and I think that this really comes back to the medical doctor kind of having that role of the biological, and also because of, you know, insurance and time, like you guys don't have as much time to do all of that. So psychologists will be the ones who are more likely to do these like big long appointments and then compile a report together, just discussing all those findings. So that's kind of a big piece of what we do that other professions don't do as much. And in terms of therapy, we can both do therapy.
You've probably got more training in it.
Yeah.
We definitely get training for psychotherapy and supportive therapy, talk therapy, counseling therapy. They're all the exact same thing, just with different names. And then there's different approaches, which I'm sure people hear a lot about: cognitive behavioral therapy, or CBT, DBT, ACT. In short, there's a lot of various approaches to therapy. We get experience in them, but you guys, I assume, get more.
Yeah, and that again is because that's something that we that's kind of how psychologists work. Like, you would have more frequent appointments with your psychologist to work on, say, the behavioral issues or like cognitive distortions, things like that, and then you would, you know, come in every week for that, versus with psychiatrists you're like more likely to come in intermittently.
Yeah.
Usually
we do appointments when someone's coming in on an outpatient. We usually, you know, do anywhere from a month to 8 weeks, sometimes 3 months, 6 months if somebody's incredibly stable.
But do you have any weekly patients?
For therapy.
Yeah.
And then sometimes if, you know, someone needs it, we can do every 2 weeks. If we think it's really helpful, or sometimes when you have someone in a rough situation, you can do weekly or 2 weeks.
Yeah. Okay. Yeah. But basically, we can, to sum up, we can both do it. Psychologists tend to do, in terms of hours, a little bit more. Yeah. And ideally, I wanted to leave on this note, ideally, we would work together.
Always.
Ideally on an integrated team.
The best thing is if everyone's working together. If you have, on a team, you have a psychiatrist helping manage medications, a psychologist helping with therapy, a social worker managing the resources that someone has, a person's primary medical doctor. Really, sometimes you need all of these people working together, and when the opportunity allows it, it really is just wonderful. Sadly, because of cost or insurance or access to resources, it's not always the case, but it really is the best way to go. And again, you don't always not every person needs their own dedicated psychologist, psychiatrist, social worker, family medical doctor.
Not everybody needs a team, but it's nice to have.
When that time comes, it's always good to have those people working together.
Yeah. So to wrap it up, teamwork
makes the dream work.
That's right.
Thank you.